Hi everyone, I'm Dr.RakheeYadav. Welcome to my live session today. The topic we'll be talking about today is COVID-19 variants, as well as we'll be debunking some myths along the way. And today's special guest is Dr. Sangeetha Sinniah, a pediatric infectious disease specialist and an immunology fellow. So let me just invite her on board. Hang on. Just waiting for Dr. Sangeetha to join in. Hi.
Hi, hi.
Hi, Sangeetha. How are you?
I'm good. How are you?
I'm good. I'm good. Thank you so much for joining us on your busy weekday night, in between work and stuff like that. Oh, I'm sure. I'm sure. So many cases and so busy at work. But thank you so much for taking the time out to talk about very controversial topics, variants and myths and all those kind of things. So without further ado, would you like to introduce yourself?
Okay, do you want to wait for a few more people or you want to
No,
start?
just go ahead. Yeah, go
Okay,
ahead. Go ahead. It's the video will be saved on my IGTV as well as on my YouTube. So if anybody's missed the beginning, they can always just go to just reverse back and watch the IGTV in the beginning. So go ahead, introduce yourself.
all right. Hi everyone. I see a few familiar faces. Hi Jazz. Hi Melinda. Hi. Okay, so for those who already know me, I'm Sangeetha. I'm actually a consultant pediatrician, and I've just recently embarked in a fellowship, which I'm now entering my third year. So I'm doing a fellowship in pediatric infectious disease, and I'm subspecializing in pediatric immunology. So my main focus will be actually on primary immunodeficiencies and pediatric immunology. And it's actually a very new subspecialty, especially in the Ministry of Health. So when I come out, it'll be like one of the first in Ministry of Health, because there's a few in the universities. Yeah, so I mean, we definitely need more people to speak more about, I mean, given the rise of, this pandemic and, COVID-19, it has truly, made us realize that, we need more people who are based in infectious diseases, in immunology. Yeah, so, it has just highlighted that.
Very niche profession you have. But thank you so much, because I think coming from you, the expertise itself, it would definitely ease my heart to know that certain answers are answered in the best way possible. So I'm going to go straight into debunking some myths. All right. So I've got a couple of myths here, but I'm going to outright say they're myths, but I want you to debunk them. So COVID-19 vaccines, can they cause COVID-19 infections?
Okay, so I know it seems like the vaccines cause the infections, but actually it doesn't. So the vaccines are actually made out of very tiny particles of either killed or inactivated viruses. I think most people know that, and it's been used worldwide, and I mean for time and like I think for ages now, especially in children, like for instance for measles and all. And so the purpose of the vaccine is actually to slowly build the immune system so that the body recognizes the threat, and it works in producing antibodies, which actually fight the infections. So something foreign that attacks our body. So you need the vaccine so that that's why you don't have, it's called a passive immunity, where you give the immune system a little bit of kick and you get antibodies towards it. Yeah.
Excellent. And you have the new technology where you have the mRNA vaccine, which is basically taking a very small genetic component of the vaccine, doing the same thing that what the previous vaccines were do, which basically prepare your body to fight against the infection if it comes. So getting the vaccine does not cause the infection. It actually just preps your body to have the soldiers ready in case the war starts. The soldiers are already right up there. All right, so the next one we're going to go into is COVID-19 vaccines and microchips.
Yeah, okay. So in the beginning, yes, there was all this scare about COVID-19 vaccine, and they're like putting in microchips, and
Yeah.
they're putting in
Magnets.
5G networks.
Yeah.
I mean, most of us have got the jab by now. We didn't see any foreign materials, and okay, I've had it for at least a few months. I think you've had it for at least a month plus, and you
Yeah.
don't seem to like have any
Since
new
March, so a few
superpowers.
months as well. Yeah.
Yeah. So it's definitely safe, and yeah, there's definitely no microchips in there.
Okay, so we're not all that important that the government needs to know what's happening to us at 24 hours. So yeah, there's no microchips. As far as the 5G network, I don't see my Unifi bill going down. So no, I don't think it's helping me in the 5G network as well. One thing that magnetic part of it, I think it was debunked. The lady who actually said it was magnetic came out right and said that she lied. So, I mean, we have that there. So what about ingredients of the vaccines? Like some of them are worried that, it contains fetal cells and all these funny things and all. So what about ingredients of the vaccine?
No, as far as I know, there's no fetal cells, and it's actually quite safe. I mean, all the materials used have been tested, so it's actually very safe, and it's really I mean, it's very trace amounts which are easily excreted, even if it is. So yeah, it's made out of very safe materials.
Okay. And can COVID, I mean, if you get COVID infection, do you still need the vaccine? Like some people say, I've already got the infection, I don't need the vaccine, I've already got the antibodies, so do you still need the vaccine if you've gotten the infection itself?
Yeah. So at this point, when we get COVID, we don't really know how long our body produces, or how much of antibodies our body produces. So it's said that the antibodies can last up to about 3 months, but we don't really know because there's not really that much trials on that. So for the time being, we actually still need the vaccines because, as you know, there are new sorts of variants. So just like how you can get dengue more than once, you can get it 4 times. Just like that, actually, we don't know how many times we can actually get COVID. And I've known people, I think, that have got COVID at least more than twice, even. So even those people still take their vaccines. Yeah. So you definitely need to take. Yeah.
So that brought me to my next myth, which was, can you get COVID-19 vaccine more than once? So you've already answered that. Yes, you can get COVID-19 more than once. So it doesn't mean if you've got it the first time, you are still exposed to yourself getting the variant versions, or even your body coming up with the long COVID. So you definitely need to get the vaccine. And plus, it has actually been shown that if you have long COVID, or what we call the long haulers, when you get the vaccine, it actually reduces your symptoms of a long hauler. So definitely go get your vaccine. In our country, they say that there's a 3 months gap between your infection and the date you should get your vaccine. But do speak to your doctors about it and get the appointment as soon as you can. So now we're going to go into variants. I think we've debunked a few myths that the most questions that I've got about myths, but we're going to go into variants now. What are VOCs? Everybody's talking about VOC. What's VOC?
Okay, so I think before we go into VOCs, VOCs, for those who don't know, are actually called variants of concern. So there's two types. There's one is a variant of concern, there's variants of interest. And I think before we know that, I think we just need to know a little bit about these viruses. Okay, so these viruses actually, they must evolve in order to survive. Right? So we know that, if you put them in any sort of environment, they need to survive just like any other living being. So sometimes when they tend to survive in a different way, meaning that they want to make copies of themselves. So sometimes they accidentally make copies which are either good or they are harmful. So sometimes if they are good, we're not really worried about them as long as, they don't cause any problems later on. But if they are bad, so these are what we call as variants of concern. So why do they become concerned? Because number one, they are known to be maybe more virulent. So that means they cause more problems. Okay, so they are more infective. They cause people to get more infections, and sometimes it can be even worse. Like I think the current variant we're seeing now, I think what is known as the Delta variant. Yeah, so I think the Delta variant is actually causing a lot of havocs, especially I think it's said to originate from India, and they've already renamed all of them. And so these are the variants that we really need to keep an eye on. So those are the difference between a variant of concern and a variant of interest. And how would we know what these are? It's all through genetics. You actually need to sequence the DNA of the virus, and in order for us to find out. Yeah.
Okay, so there are so many variants out there. In fact, I was reading up, and it said there are thousands of variants, but it's like you mentioned, there are only a few, the alpha, beta, gamma, theta, and delta, of course, that are actually the ones that we are concerned about. The other thousands are the ones that actually replicate and kill the virus themselves. So we're not really bothered about those ones. It's the one that increase transmissibility. It's the ones that cause death, and the ones that cause severe COVID is the ones that we're worried about. And so just touching a little bit about Delta, why are we worried about Delta at the moment?
Okay, so Delta is said to, especially like we've heard of the outbreak in India, so it's infected a lot of people, and compared to before, like when we first saw the first infection of SARS-CoV, for some instance it wasn't so rampant. That means it didn't really affect people. We didn't have people brought in dead. We didn't have people having very severe respiratory distress. Difficulty in breathing, oxygen levels low. So I guess that's one of the reason. Yeah, that's one of the reason why the Delta variant has been said to be very, very. We have to be very cautious about the variant, and we have to step up our measures. Yeah, so that's one of the reasons. Yeah.
All right. So the Delta variant, like when you talk about R0, Malaysians like to talk about R0. So our current R0 is about 0.9, about 1 to 0.99 around that, which means that every one person that has COVID can infect another person, or maybe 1 or 2 people, right? So when you have an R0 that's higher, and the Delta variant has an R0 of 6 to 8, so which means it can actually affect 6 to 8 people. It's just one person. So that's why the clusters are so high, the transmission rates are so high, and the Delta variant is causing more deaths. And like you said, the brought in dead numbers was so alarming. In fact, it came to a point in Selangor where we actually reached 27% of us that were brought in dead, the mortality. And I think that was really scary to me. So when we talk about Delta and all the variants, does the vaccine cover these variants? Like, we know the vaccine covers the original SARS-CoV-2, but what about the variants? Do they cover, especially the Delta?
I think there's very few studies that slowly they're rolling out, because when you have a new variant, they actually need to restudy and retest. And I think the few studies that have come out are actually showing quite promising signs, especially towards AstraZeneca, Pfizer, Moderna. So it's known that it does reduce, even if you get infected. Again, it does reduce the it reduces you from getting hospitalized or even the deaths, like you mentioned. So vaccines are definitely one part, but you still have to ramp up your public health measures, and make sure that you have the rollout in place as well. Yeah.
Absolutely. And there was a study that was done for the Pfizer vaccine as well as the AstraZeneca study that said that single dose only gave you up to about 33% protection. But if you completed your 2 doses, it gives you a protection. This is for the Delta variant. It gives you protection up to about maybe 88% protection for Pfizer, and about 84% for AstraZeneca. So if you go and get your single dose, yes, you will get protection for the original, but you won't get much protection for the Delta. So make sure you don't miss your second appointment for the vaccines, and continue to maintain your SOPs.
Yeah, that's
so like Dr. Sangeetha said, the public health measures that are already in place, make sure you continue doing that, because your protection only starts 2 weeks after getting the vaccine, the second dose of your vaccine. So let's go into something a little bit more controversial now. Ivermectin. Everybody is talking about ivermectin. We should take it prophylactically. We should give it to our dogs and cats, and we should take a dose too. So we should give it to severe COVID patients. We should give it to no asymptomatic patients. So is it really a wonder drug? Should I give it to even my puppy and my kids and myself? And
yeah. So I think, again, like, how they discovered ivermectin was during the initial part of the pandemic, where, every single country was trying to raise and find out the drug that could, just kill this virus. So it was actually a computer kind of an AI kind of system, which found that ivermectin possibly has certain components that can denaturalize the protein in the virus. So it is found to be effective in the labs. But then again, we don't know this, whether, how effective it is and at what stage is it effective, and with the variants. So all these questions still remain unanswered. And I think because of that, WHO, Ministry of Health Malaysia has all recommended against using. And to be fair, ivermectin is not an easily available drug. So you can't, just buy the drug over the counter, especially in Malaysia. And you still need to... I think we still need to wait for the trials. So there is one which is being conducted in Malaysia, in Ipoh actually. There's still not much on the trials. It's still just being it's just been started. And I think as time goes on, we will probably get to know a little bit more. UK is also doing a very large trial on ivermectin. So we probably have to wait for that. Yeah.
At the moment, I think it's just basically anecdotal experiences from a few doctors here, a few people there, and all that. So, but doing a proper scientific peer-reviewed trial, a randomized double control, what we've always heard from medical school, there are RCT, double-blinded, one of those high fancy trials that actually shows a difference. And Malaysia is actually doing it, and it's actually a multi-center trial, not only in Ipoh, all over Malaysia. I think they're looking at getting about 500 people for the trial at category 2 and 3, and then they're going to see how many of them actually progress into category 4 and 5. So having said that, I don't think you guys should go out and buy ivermectin and give it to your puppy and your kids and yourself at the moment. Let's wait for new data and more information, like Dr. Sangeetha said, to come out. So at least we've got some idea on its safety, what dose would be recommended for what stage of the COVID-19. So such a controversial wonder drug that we call it, but at the moment, not enough studies to show that it actually works in every way possible, like what they're saying it does. So what about treatment options then? So we know that wonder drugs don't exist. What are the treatment options that we have at the moment if you have COVID-19? I know you're a pediatrician, fellow pediatrician like me, so your treatment options will be more focused towards kids. So, I mean, we'll go that way. So at least I also know what's happening with the children in government hospitals. What are the treatment options then?
Yeah. So I think largely it's symptomatic. I mean, we do know that stage 1, 2, 3, I mean, most of the time we don't give anything unless, going on to 4 and 5. And then again, it is based on the symptoms, and we do watch out for signs of ARDS in the lungs, and also for cytokine storms. And we do treat accordingly. So for the time being, actually, there are very few drugs. One of it is steroids. Even the antivirals, there's not enough trials that actually shows the efficacy. So it's there in the guidelines, but you don't really prescribe. So a lot of times it's treating the secondary bacterial infection. The steroids also, if you have an underlying history of asthma, or your lung has got, like ARDS kind of picture, you're ventilated, then possibly, yes, there is a role. But largely, it's still supportive, and most children still do well, despite, so most children do well unless they have, an underlying condition or comorbidities, then, but generally, children still do well for the time being.
Yeah. Excellent. So it's mainly symptomatic. There's no special drug that you can get, but we have to make sure their oxygen is good, their hydration is good, they are nourishing. I mean, your your nourishments are good as well in the ward, and you give them your antibiotics, and we'll just follow it, whatever that is in the protocol at the moment. Excellent. So should children be given vaccination? So we know now that children above 12 years old, they've been advocated to get the COVID-19 vaccine, mainly the Pfizer, because that's the most studied among children. So do you think these children should be given the COVID-19 vaccine, and why?
Okay, so I think WHO's stand on it as of June is, children are not priority to get the vaccine. So yes, if you're talking about children who are probably at risk, may need it, but actually at the moment, if you read WHO or you watch the videos and all, actually they do say that you need to vaccinate a large number of adults first. So the risk group is still at, the older age groups, those who are at a higher risk of death, severe illness, because again, we know from data worldwide that children are not as badly affected as adults. So they are not a priority, but of course, after you've finished vaccinating everyone else, and as there are new trials, because there are a lot of new trials for all the other vaccines, like you mentioned, and the age group is coming down. So, like below 12. So I think I would say eventually we would need to vaccinate everyone and children as well, but it is not a priority at this moment. Yeah, that's how I would say, except for a select few.
Okay. So I would maybe word it this way, that if you have a high-risk child, a child who's asthmatic, a child who's got a chronic kidney disease or immunocompromised child, leukemia and things like that, those children definitely would fall into the priority list of getting vaccinated, because these would, if they eventually get COVID, they would get severe COVID requiring hospitalization or even die. So it will prioritize these children, the ones that are high risk. But for the rest of them, you can get yourself registered as and when you get an appointment. There's no issues. There's no contraindication to the children's getting vaccinated.
For the time being.
One of the things that you mentioned was most children are asymptomatic or they get mild illnesses. But there's such a thing called the MISC. Everybody goes around MISC. So do you want to tell us a little bit, maybe touch a little bit about MISC before we...
Yeah. So a lot of time, I think in Malaysia, we've had a number, a few. Probably, I wouldn't say a number, probably less than 10 patients. So, and sometimes actually, it is actually difficult to differentiate between MISC and COVID itself, because when you do actually check their PCR, they are still having a very high CT value. That means they are still having some sort of COVID infection. So it's very difficult to say, does this patient actually have MISC or is this COVID? But like you say, MISC, classically, it's meant to happen after about 6 weeks, after a COVID infection. Yeah. And they tend to have like inflammation of many of the organs, especially the heart, the gut, and your brain. So, you have signs and symptoms based on that. So your heart, you may have a higher heart rate, and your brain, you may get seizures. Or very high fever again, and so again, we need to pick them up, and treatment again is symptomatic. So we don't straight away, jump and treat. It's a lot of times it's symptomatic, and we treat accordingly. So sometimes we use IVIGs or prednisolone, but a lot of times it's still symptomatic. Yeah.
Okay, and just for everybody out there who's not sure, MISC is multi-system inflammatory syndrome by COVID-19, right? So it, like Dr. Sangeetha mentioned, it's a complication of COVID-19. The children are asymptomatic or they have very mild symptoms when they do get the infection, but 4 to 6 weeks later, they kind of deteriorate. And that's when they require hospitalization and all that. And then when you look at their PCR, they're actually still positive. So you're not sure whether you're still having the infection because it's already 4 to 6 weeks since you've got the infection, or whether this is MISC itself. But in Malaysia, so we've seen less than 10 cases. And it's not very, it is rare, and it's not very common, but it's something to look out for in children. So that's why I say that even though children are asymptomatic and mild, they can still develop complications of COVID-19, which we would say definitely, they would definitely require the vaccine to protect them from all these things. So rather than get the infection itself, best to just prevent it. So what is your general advice especially to parents or to people who are immunocompromised out there?
Well, number one, I mean, if you can avoid going out, especially now that the infections are really high, please do so. And definitely the general measures like double mask, your face shield, and if you are in contact with somebody who has COVID and you are a close contact, I think you need to get yourself tested early. So that you don't we don't wait, like we can monitor you at home. I mean, rather than monitor at home, you can monitor them in the hospitals. And just make sure that if you know you're at risk, you have comorbids, then you probably need to get you need to seek medical attention slightly earlier. Yeah.
All right. So just look out. I mean, if you're immunocompromised, don't delay seeking treatment. Always seek treatment earlier, because there's so much that we can do in early treatment. But if you seek treatment late, there's not much that we can actually do. So with that, I mean, thank you so much, Dr. Sangeetha, for taking the time out, clarifying so many doubts, debunking some myths with us. For everybody else who missed certain parts of it, the video will be saved on my IGTV, so you can always just go back and review it all again, as well as on my YouTube channel. So go and check it out, and I'll send a copy to Dr. Sangeetha as well.
Right.
Thank you so much, Dr. Sangeetha. Take care.
Thank you.
Bye.
You too. Bye. Take care. Bye.